again, everyone, Mark Hackle, Macomb County Executive, John Paul Rea, Deputy Executive here, just giving you our Monday update, what's going on with the COVID situation here in Macomb County. How are we looking as far as the numbers this month?
Mark, again, still stable trends when we look at the cases and deaths here in Macomb County. To date, in July, we've had 225 cases that have been confirmed by the state and is now up on our community dashboard. And then currently right now, about 3 deaths this July. Those numbers are still coming in over the weekend reporting as we get kind of what comes in from the state of Michigan and also our healthcare professionals on that end. And again, all the information that we get is not only vetted by the state of Michigan, but a team of accredited healthcare professionals here on I-side that ensure that that information up there is the most critical and reputable to Macomb County.
So it still falls in line with what we talked about, flattening the curve. It's amazing what's happened here in Macomb County on behalf of the public weighing in, following CDC guidelines, as well as our businesses that were coming back into play, trying to keep not only their employees safe, but keeping their customers safe as well. Macomb County, credit to the people here. I got to tell you, aside from a glitch here or there, it's incredible how far we've come. And again, a lot of support from our health department, following up with contact tracing, working with our businesses, along with our planning department and emergency management. So, question becomes, what are we doing as far as opening up other sectors of the economy here? Is there this potential of moving back on behalf of governor's orders? The numbers don't fit that, I guess, if you will, dynamics. Pulling us back out of a crisis with our economy, we are, I think, headed in the right direction. So the trending has been incredible. 3 as far as deaths. Boy, hospitals are even telling us we can handle any uptick or any surge, whatever this uptick terminology is.
So, Mark, it's interesting where we were at a couple hundred cases per day to now on a day where, the state's highlighting an uptick through the state. For Macomb County, it may mean just a couple dozen cases. So a couple hundred to a couple dozen is a massive spectrum there as far as our capability for our community to respond and understand. You brought up the whole notion as far as some of the governor's orders. This past Friday with the governor enforcing the facial covering and the masks and everything that are now part of elements within enclosed public spaces. These are different things that we continue to assess, working not only with businesses to understand the parameters, but ensure that individuals know how to get connected with the state and get clarification.
And I think that's the question, is the clarification. That becomes the challenge in us. Again, I repeat this often. What is it that constitutes an uptick? What are the numbers we're looking at that kind of define that? We don't know. What makes a determination whether we're in that phase 5, phase 4, phase 3, according to the My Safe Start plan that the governor put out. Initially it was flattening the curve, talking about the number of cases that we're seeing, the actual number of deaths, the percentage of people that are testing positive. All of those criteria have been met, and there's no question about it. We are in that flattened curve phase, and should rightfully be in phase 5. However, we're not seeing that. So I can't answer the question. I get a lot of, in particular right now, the fitness centers saying, we provide a fitness facility, something for people's health and wellness. We're going to do it. Some of them are opening, and they're just doing it anyways, and we haven't had a problem with them from our health department. And some people say, well, why aren't you shutting them down? Once again, these are governor's orders, much like we just saw coming out on Friday at the end of the day. This governor order coming out saying you must wear a mask and making it a criminal penalty if you don't. I guess I heard, saying, well, we're not going to go out there and issue a bunch of fines or whatever and citations. Well, then don't make it a crime, I guess, if you're going to do something like that. Recommend. And people will usually follow guidelines, and some that don't, I get it, stay a distance from them. But the reality is, this was now made a crime. And I think what you're finding from law enforcement is a pushback. They're very much challenged by this, and I say it for this reason. I heard one of the news media personalities saying, well, it's kind of like people were upset about seatbelts at first, and they finally got used to that. If you understand when it comes to law enforcement, having to enforce laws, usually they're codified laws that are either in a motor vehicle code or statutory laws of criminal offenses. But they've gone through a vetting process based upon our democracy, meaning that there has been a legislative body of people that we have elected to go to Lansing and decide what would be the best, I guess, policies and laws that people should be guided by. And they're vetted. They go through committees and then afterwards sent off to a governor for signature. Crimes that have associated penalties with them. That's not happening here. And so law enforcement is saying, and this is what I'm hearing from them, it's very questionable as to their extent of wanting to go ahead and enforce something that one person has made that determination is a violation of law with a criminal penalty. So they're saying hard for them to go around to be the mask police. And we're getting inundated every time somebody is going in a restaurant or some grocery store not wearing a mask now, they're going to be trying to respond to that. And some of them are saying, we're leaving it to the governor's office. Unfortunately, the governor has decided to hire about 200 people to take this on herself. And so there's a phone number. If you happen to see or have a complaint about somebody not wearing a mask, there's a phone number you can call now to get a hold of the governor's office or her team of people that are going to go ahead and monitor this. So the number that you're going to see on the screen here is 888-535-6136. Again, that hotline number, and the governor's office is handling this, 888-535-6136. And there's also an email that was given to the public if they want to email a complaint about somebody not wearing a mask, where it's ag-covid19@michigan.gov. Again, ag-covid19@michigan.gov. And so I say that because many law enforcement agencies are thankful that the governor decided she wants to enforce this, her own rule or her own law, through personnel or people that she has. So whether it's through the state police or 200 people she just brought in from the Department of Health and Human Services, they're going to handle this. And so you don't need to be calling 911. In fact, that's even recommended that you don't, because they're saying it's not an emergency. So do not be calling 911 because you see somebody not wearing a mask. And if you're going to email somebody, the recommendation isn't emailing your local police department, it's emailing that email address that was just given to you for those type of complaints. So fortunately, with her law that she put into effect, people are able to get response from someone, and it's through the state. And again, for clarification on a lot of these orders, we have it listed on our website, the actual orders from the executive orders of the governor. You can go to that, look it up, but also if you're looking for clarification, get a hold of the governor's office for that. So again, do we recommend people wearing masks? Absolutely. Keeping it social distance. I wear mine. If I go into a store, I have it on. If I'm 6 feet from somebody, many a time, if somebody wants to talk, yeah, I'll probably pull it down if they're a distance from me to talk. But far be it for me to get charged with a misdemeanor crime now for not having a mask on, and I wouldn't recommend that for anyone else either. So it's going to be incredible, the challenge we're going to see with people want to argue amongst themselves, and chastise people for not wearing it and or being defensive because you don't want to. So it's interesting times.
Mark, I think it's very fascinating when we look at all the different elements that, whether it's our first responders, whether it's on the police side, whether it's on the EMS side, have to juggle when they're going into a situation right now. At the onset it was, okay, does someone have coronavirus? Is it something that I might contract and everything? Now having a whole nother added element with regards to the facial coverings, is it an enclosed public space, is it a private space, all these different things. And it's one of those things that now it is law. Obviously individuals are going to want clarification and know how it impacts themselves, their businesses, and even the welfare of their families. We have all these information available at macombgov.org, very much guiding people to go to the state, get that clarification, and undoubtedly we're going to keep moving forward, assessing each one of these elements, understand how it impacts the county on a day-in, day-out basis from the operations that we provide to our 880,000 residents and also our 18,000 businesses. But I think more importantly, approach it with common sense, a level-headedness, and again, that personal responsibility and your own comfort level too.
And that's a great point. You just made it, this personal responsibility. You're 100% right. I think people should be wearing a mask. I mean, especially if you're around other people, no question about it. But so I agree with that. But when it comes to making law outside the legislative branch, I can't agree with that. I go back to the simple democracy of what we have here in place, and to say that we shouldn't be engaging our legislatures on, criminalizing activity of the public. Boy, I tell you, it goes back to the constitutionality and my impact as a law enforcement officer. I swore to uphold the laws of not only the county of the state, but to do so was vetted through a legislative process. So I have a challenge with that. And why we're not using the legislature, I'm not sure. You would think that would be part of the process still, but for some reason it's not. And now this will be a misdemeanor if you're not wearing the mask. So 2 issues. You should. Okay, that makes for a safer environment, but separate that. I got a question about the process right now, and to me, I find that extremely concerning. And with that being said, we get challenged all the time. In fact, I just got challenged over the weekend about the numbers you just got through talking about at the onset. There's some people that decided to go ahead and email, and they were critical on other people's Facebooks when they posted our videos saying our numbers aren't true. In other words, that there are more deaths or there's more cases, and they know this for a fact, and we're just kind of not using numbers that are appropriate. Well, I can't help but say that is absolutely factually not correct, that statement. our numbers are numbers we are getting from the state, and they're vetted through our health department. So what our numbers are on our website through our dashboards that you're seeing are a direct reflection of the numbers we're getting from the state. So, I know we had talked about this over the weekend. When I got that call, I'm thinking to myself, wow, that was a shocker. Somebody's trying to tell us our numbers are higher than what they actually are, and we're kind of discounting the real impact of what's happening. Factually incorrect.
Mark, our health department is working in lockstep with the state of Michigan and DHHS, not only to ensure all the information that we release is 1,000% certified by the appropriate individual at the state level and by the appropriate individual here within the county. Anything in our dashboard not only is in line with what the state has, but we also are managing the sequencing. The state will come out and certify numbers, usually at 3 o'clock in the afternoon. Then we go through, look at it on our end, and make sure it gets updated on our end. On the weekends, there's always a data dump on Monday and Tuesday as far as the backlog of what they do with cases. But any data, information, facts that we have out there is the most factual with regards to all of the structures and protocols that we have. And in no way, shape, or form are we trying to be nefarious in any way or misrepresent these facts.
And I find it interesting because this whole data dump, once we get the new factual numbers from the state, we put them on our dashboard. So if there's a conflict with the numbers in the meantime, it's at the state level. But again, I understand that. I mean, they're getting inundated with, tests, positive tests, and people that have died as a result of it. Make a determination, is it a death due to COVID? So I get that. So the state, there's going to be some changing or shifting of the numbers as time goes on. We get that. But immediately when we get those numbers, our health department is attributing those numbers specifically on our website as a result of that. So again, yeah, it may be shocking that our numbers are so low, but I think it's because, once again, I go back to businesses here in Macomb County that have been able to open, have been doing it in a very responsible way. And when there is an incident or two that may occur, our health department is working alongside of them, along with emergency management and our planning department, to engage them to make sure that they're keeping a safe environment. So, yeah, it doesn't surprise me that our numbers are low here in Macomb County because of the way the people are acting in Macomb County, but the way we're engaging with them in Macomb County. So I'm comfortable with us trying to figure out how do we, I guess, if you will, try to deal with this economic crisis by allowing businesses to open in a responsible way, along with making sure we're being very responsible and working with the public in trying to make sure they're keeping one another safe by doing the things that are recommended by CDC guidelines. So, again, I found that interesting, that somebody would even, question the numbers we're relaying to them, as strange as that may be.
Mark, we're always willing to talk with individuals should they have any concerns with regards to the data or information that we display, but this is some of the most sensitive and critical information that we can get out to the public, and we take it incredibly serious.
Yeah, so on that note, I just want to remind everybody to continue to keep safe. It is the law now, even though it didn't go through kind of the democratic process we're normally accustomed to. The governor, through executive order, has said this is a misdemeanor, and you could be charged with a fine along with that as well if you're not wearing a face covering in some of these locations now, or these businesses. And the businesses can be held accountable for allowing you to come into their places as well. So with that, you've been given a couple numbers that the governor wanted you to have to contact them if you have a complaint or concern, and even they recommend don't call 911 to complain about somebody not wearing a mask. And we really don't want to see the friction between the public over these issues as well. I mean, it's that's not the best way of handling it. So if you're in a restaurant or something, you're near somebody, please put the mask on. It was probably just one of those things I think that would kind of resolve a lot of the problems to begin with. So on that note, on behalf of JP, myself, and the rest of us here in Macomb County, we want to continue to remind you to keep you and your family safe, and again, continue to follow us here on MacombGov.org.